Hello, East Texas. I'm Craig DeLisi. I'm a family physician here in Mount Pleasant. And today I'm going to be giving you an update on what we're seeing with the most recent surge in coronavirus at the national level, state level, the local level. And then I'd like to also spend some time answering questions. I'm a family physician locally, and as I take care of patients every day, I find myself answering the same questions for the most part over and over. And I thought it'd be good to compile a list of these and go through them in a way where other people were able to watch them. One of the challenges during the pandemic, I think for so many people, has been trying to find good sources of information and trying to know what's real and what's right and what's true. I think that our ability to discern what's right and true has been really shaken in the last year. Social media tends to be one of the main avenues for disseminating information, and as most people know, it's not always the best source. I hope in times like these that people can talk to their healthcare providers, who they already trust, to obtain answers to many of these types of things. And I realize everyone watching is not my patient, but many of you may be. And so I'm just hopeful that the answers and the things we'll go through may clarify some things that you may have questions about. So I'll start by just sharing an update on what we're seeing with the Delta surge, which has been significant over the last month. And I'm going to show some graphics. The first one I'm going to look at is from the New York Times, just updating what we're seeing with cases. If I can get my mouse on here. Here we go. All right, so this is basically from the beginning. This is February of 2020. Moving all the way toward now, and this is just new cases. So at the worst, the peak so far of this pandemic has been in January and February of this year, and you can see at that point we were seeing, I think at the worst 300,000 new cases a day. So very severe. As the vaccine distribution rollout started in earnest, we saw it drop precipitously, and things did well heading into May, and then after May, it was fantastic. I mean, we had a season there where things seemed very normal. We were seeing almost no new cases, and then just before July, we started to see an uptick, which is where we are right now. And as you can see, these numbers are significant. Where is that one day right there? I think one of these days is over 200,000 cases. So yeah, 259,000 cases, which is slightly less than the most we've ever seen in a day. So nationally, we're seeing quite a bit. There's a couple other graphics here. This shows by region. The blue, light blue right here, is the South. And so this is just uptake in cases. Mississippi is this dotted line. And this is per population, per capita. And it's showing that disproportionately, the South is not doing very well. The Northeast is the dark line down here. And so the number of cases is rising very, very, very quickly. These are the trends in the different states, excuse me. And I sort of rank these from top to bottom. New cases per 100,000 in the population. This is what we're seeing. Texas is in this group. Hospitalized patients, which is one of the most important statistics in my opinion, because those are the very, very sick ones. Texas is in the top 10 there as well. As far as other trends nationally, these are the hospitalization trends. These are the number of cases. Hospitalization-wise, we're seeing the numbers precipitously rise again. So we're not quite at the level we were in February and January when things were terrible. We are headed in that direction. We're certainly at the second worst place we've ever been since the pandemic started. And then deaths. This is the report of deaths. This is initially when things were in New York City. We had no idea what was going on then. Deaths were at the worst in January and February, and then have trickled to very, very few nationally. I mean, the state there was only 41, and now we're seeing things move back to 1,000 or more per day. At the worst, they were around 4,000 a day back here. But this is concerning. All right, the next slide is one I really enjoy looking at, and I look at every day, and this is the Texas Department of Health website, and it's just showing the trends. This particular slide is showing hospitalizations, And so again, these are showing what we've seen in the past. So we had Texas was a little bit behind New York City, so our first surge wasn't until last summer. And then this was the bad one in February and January of this year. At our worst, we had 12 to 13,000 patients in hospital beds. But look where we are right now. We're really close to that. Each day this number is going up. It's still going up. We have not peaked yet. And we have nearly as many patients in Texas hospitals today than we had at the very worst in January and February. And that is very, very concerning to me. Another statistic that, I'm not sure if it's, let me see where, I think it's over here. We are in this region, Trauma Service Area F, which is here. And this tells all the available beds and what we're seeing in the different regions. So our trauma service region includes Paris, the Sulphur Springs Hospital, both of the large hospitals in Texarkana. And among all those hospitals, we currently have 4 ICU beds available. That is extraordinarily concerning as a physician because ICU beds are not just used for COVID patients. They're used for people with bad motor vehicle accidents and for people with bad heart attacks and strokes. And so to have 4 ICU beds available, that's fewer than the number of hospitals we have for quite a large area. So that's something I always pay close attention to. In my opinion, that's a crisis, extremely concerning. Locally here in our community, in our clinic, I will say right now, we're seeing more patients a day than we have seen ever since the pandemic started. We're having more patients call for appointments. We're having more positive tests than we've seen at any point. Now, that's not translating into numbers in the hospital that are as high because on average, we're seeing younger people that are largely unvaccinated. And because of that, they're not going to typically get quite as sick. But because the absolute numbers are so large, we are seeing elevations in the total numbers in the hospital as well. Currently today in our hospital, I just asked Terry, and he said we have our max we can have right now of COVID patients is 15 in the hospital. That's exactly how many we have, including 5 in the ICU. And we have 3 in the emergency room that are being cared for there as an overflow. And that's also a concerning situation. We're seeing it every single hospital. I know a few days ago, one of the large hospitals in Tyler had nearly 50 patients in the ER being cared for in the ER. That means they're patients that need to be in the hospital. They're that sick, but there's no room in the hospital, and there's also nowhere else to transfer them. And so this is what we're seeing, and these numbers are alarming. They should be alarming, and my sharing them is not to incite fear, but just to really paint an accurate picture of what's going on. My concern, and every doctor's concern, is that the system is going to crack, and is that because of lack of resources and lack of personnel, that people will not get the care that they need. And people, even with other medical problems, someone with a complicated stroke or motor vehicle accident will suffer because of lack of resources as well. And we're really on the precipice of that, to be honest. Lastly, statistics-wise, I just want to show where we are from a vaccine standpoint. This is from the Washington Post, and this was when the vaccine rollout started in December and into January. February, we were really seeing some good numbers, 1 million, 2 million doses given a day. I think we got up at the peak to 3, or I guess 2.5, 3 million doses. And then that's also dropped. But over the last month, I think we have seen an increase again to where we're giving about 1 million doses a day, which is great. And currently, where was that other statistic? We've had almost 200 million Americans have received 1 or both doses at this point, which is encouraging. So that's over 50% of the country now is fully vaccinated, with over 60% that have received at least 1 dose. And so we're moving in the right direction there. Okay, we can go back to the PowerPoint. All right, so that's sort of an update on where we are locally, nationally, and then a quick update on the vaccine. All right, so I'm just going to answer questions that I'm that I'm seeing regularly. The first is about masking. Are we really back to that place where we need to mask? And the answer is I do think we are. And masking is honestly, in my opinion, is based on what you're seeing at the local level. So if you're seeing high numbers of cases at the local level, then that's when masking indoors is probably necessary and wise. And we're back to that point. In fact, I'm not so sure because it's hard to keep track of things like this, but if I had to guess, I would say that right now, currently in our county, we probably have more people with COVID than we have had at any point since this started. And we'll talk about the contagiousness of this particular virus in a minute, but because of that, and because of the number of cases, I do think masking is wise. Really, it's just an attempt to slow the spread. If it can cut down on how many people a given person infects, or if it can decrease your chance of catching it substantially, then it's worthwhile. And part of this is because the rate of new infections and hospitalizations have to slow down. We really need to see a decrease here. And one big concern that most of us have is with schools opening now, where kids will be in the classroom and probably there even when sometimes they have COVID, because unless they're quite sick or have fever, they're going to still attend school. In that environment, it's going to spread like a wildfire. And I expect those kids then to go home and pass it to their families. And so, when to wear masks, I don't think wearing them outside is necessary. I haven't thought that for a very, very long time. I think if you're indoors, particularly in crowded places with a lot of people, and whether or not you're vaccinated, I would encourage you to. Now, a couple of months ago, I wouldn't have said that, and that's because we weren't really seeing cases of people with the vaccine getting COVID. Delta has changed that a bit, and so because of that, when I'm in public, I do wear my mask, either my thick one or even just a surgical mask, and the point of that is not mainly because I'm afraid of catching it from you, but just in case that I might have it and have an early case, that I don't want to spread it to you. So I do think we're back there. All right, so why are vaccinated people getting COVID? Does that mean the vaccine does not work? It's a great question. We call cases in vaccinated people breakthrough cases. The term itself seems to imply a failure on the part of the vaccine. But you need to understand that no vaccine is 100% effective at preventing infection. Most vaccines' jobs are to prevent serious infection or death. And also realizing that if something is not 100% effective, that means that there's a statistical percentage of people who are going to obtain it when they're exposed. I was talking to someone about measles the other day. Nationally, we probably have a 95% measles vaccination rate. Measles is very contagious. We hardly ever see measles in the United States because of it. Part of that is because if one person had measles, say they brought it over from Africa or another country, and they ended up in a community, almost everyone they'd be around would have the vaccine. So it would spread. In the case of this Delta COVID, unfortunately, we're seeing so many cases that because of that, we are seeing a spread. So for the measles analogy, if we imported 10,000 people with measles into a given city and dropped them in, even if the vaccine rate was 85 or 90%, and it's a good vaccine, it's probably a 90% effective vaccine, we would see lots and lots of new cases because there'd be 10%, 5% of the population that would still catch it, and then it would spread. And so really we're just dealing with raw numbers here. So it's not surprising to any of us that we're seeing people catch the virus who have had the vaccine. The Delta variant is very contagious, and this is why, this is one of the main reasons that we're seeing the spread like we are, including to vaccinated people. This slide here demonstrates what we call the reproduction rate, or the R0 of a virus. And so on the left, we have a person who is infected with the original strain, and on average, one person would infect probably 2.3 to 2.5 other people. That's on par with a lot of older viruses. A lot of viruses like influenza. On the right, we have what we're seeing with the Delta surge, which is that one person on average is infecting 5 to 9 people. That is profound. And so you can see how quickly it can spread, from one person to 6 or 7 people to 50 people, and then it spreads exponentially like that. And this slide here is showing also another way of looking at how contagious it is just relative to other strains. So on the little pink box on the left is the original strain. The bottom line, the x-axis, is showing us how contagious something is. So as you go further to the right, that means it's more contagious. As you go up, it's more serious illness. So it's basically showing that Delta variant, that blue box, is more contagious than almost every virus we've ever seen in humans other than measles. So we're talking about something that's as or more contagious than chickenpox. It's more contagious than flu. It's much more contagious than the last version of COVID. It's more contagious than SARS and Ebola and smallpox. And so this virus is extremely contagious. Now, it's important to know that the vaccine is still very effective against serious infection. And when I say serious infection, I typically mean pneumonia, which is what leads to hospitalization and death. And these slides represent that, and they're showing the incidence rates in vaccinated and non-vaccinated people for the different things. So the graph on the top left is showing that just pure infections, vaccinated people are getting them, have about an 88% reduction in infections. So you have about an 8 times greater chance of being infected if you're unvaccinated than if you're vaccinated. More importantly, though, in hospitalizations and in deaths, it's about a 96% reduction, meaning that you have about a 25 times less likely chance of ending up in the hospital or dying if you're vaccinated versus unvaccinated. And that's exactly what we're seeing. So in the clinic where I work, we're seeing quite a few positives a day, 20, 25 people a day, and roughly 10 to 20% of those people have been vaccinated. In the hospital, however, we're seeing almost none that have been vaccinated. And to me, that is one of the most important things that people need to hear who are considering the vaccine, who haven't yet gotten it, is not that all these people who are catching COVID, that it means the vaccine's a failure and it doesn't work and what's the point. But what they need to hear is that the vaccinated people, by and large, are not getting pneumonia. They're not getting hospitalized. They're not dying. I'm not saying it's not happening at all. It's happening in small numbers, extremely small numbers, and relative to what we're seeing, it's almost inconsequential. It's so small. So the vaccine is working. It's doing a fantastic job. And then one reason, and just real briefly, is, I think that's important to know, is because the difference between mucosal and systemic immunity. So the reason that people who are vaccinated are still susceptible somewhat is when we're given a vaccine, this particular vaccine, anything that goes in the bloodstream, it induces an antibody response in our blood, in our system. Well, the virus, when we're exposed to it, comes in through the nose, which is one reason masking is helpful. And we have different antibodies in our nose than we do in our bloodstream. We have immunoglobulin A primarily in our mucosa. In our bloodstream, we have mainly IgG and IgM. And so the vaccine does not really give us much protection in the mucosa. The levels of the IgA antibodies are not very high, so it means you can get infected. But what typically happens then is that people with it don't get as ill systemically, because as soon as the virus gets into the bloodstream and starts to replicate, we do have lots of antibodies that fight it. So I showed that slide showing that how people pass it. That's true, and vaccinated people who get infected are contagious. But typically they're contagious much less longer because we clear the virus a lot quicker. And so that's an important distinction. It makes some sense. It's why some vaccines traditionally have been given intranasally. And there's even thought for the COVID vaccine, maybe doing a nasal spray. I could see that coming at some point. But that's something that you may hear about that I did want to clarify. All right, the next question is, are vaccinated people the main source of the recent spike in Delta cases? And I'm not sure where this idea comes from. I think it's because people are wondering if there's a lot of unvaccinated people that don't know that they have it and are therefore spreading it. I would say the answer to the question, as stated, is no. They're not the main source. So in other words, we're seeing many, many, many more people who are unvaccinated catch COVID right now than those who are vaccinated proportionally. It's probably 80-20 or 90-10. So the main source of current spread is unvaccinated people. But it is true, vaccinated people can catch and spread COVID, as I've already mentioned. One other reason this is such a contagious virus is that the amount of virus in the bloodstream is probably 1,000-fold higher than we saw with the original strain. So it does make it easier for anyone who has it to spread it. I did also just mention, though, that vaccinated people tend to clear that much quicker, and so they're contagious for less time. I do believe, however, if everyone was vaccinated right now, everyone eligible, we wouldn't be seeing what we're seeing. I don't think there would be anything resembling a surge or spike. And this slide here sort of demonstrates that. This is showing the states with the 5 least vaccinated states and the 5 most vaccinated states. And it's looking at the number of cases we're seeing and number of hospitalizations per capita. So in other words, it doesn't matter that Rhode Island is smaller than Louisiana in this graph. We're looking at per population. So that top group with Alabama being the worst at the moment is that they have the most unvaccinated in the country out of 1,000 people, 659 are unvaccinated, so that means their vaccine rate is probably 35% or so. And it's not a coincidence that they have one of the highest rates of hospitalizations per capita for COVID. If you look down at Vermont and Maine and Connecticut and Massachusetts, Rhode Island, they have the highest vaccine rate. So as that blue line gets smaller, that means more people are vaccinated. And then not coincidentally, their hospitalization rates are much, much smaller per capita. So to me, that's just a good graphic representation of the fact that the vaccinated people are not the main ones spreading it. The more vaccinated we have, these numbers go down. And so one reason that we're encouraging and pushing that so much. Okay, can vaccinated people spread COVID or test positive because of the vaccine? I've had a few people ask me this. It caught me off guard. I wasn't really sure where that came from. I believe it comes from the thought that the answer to the question is no. So the vaccine does not cause you to either become infected or even be able to test positive, like a false positive for a test. I believe this comes from the fact that the vaccine causes our body to produce the spike protein that's on the surface of the virus. But it's important to know that this protein by itself is not infectious, meaning it doesn't cause infection in us, nor is it contagious, meaning it can't be passed to someone else. We also don't shed the spike protein. In other words, it doesn't come out of our body. We don't cough it out. We don't blow it out. If we did shed the spike protein for some reason, that by itself wouldn't infect anybody because it's not attached to a virus. It would need to be on the virus to get into the host, to steal the host's cellular machinery to reproduce and do things that viruses do. Protein by itself does nothing. The tests that we use, the rapid tests, like the ones we use in our clinic, don't test for the spike protein. I've heard people say, well, if you have the spike protein in your body, you get tested, it's going to show that you have COVID when you really don't. You just have the protein. Well, that's not true. It actually tests for a different protein. It tests for something called the nucleocapsid protein, which is the most abundant protein on the virus. And this is only found when people have the actual virus in their nasal passages. Other tests, molecular tests like the polymerase chain reaction PCR test, those look for a specific sequence of the viral genetic code or RNA. This is a graphic of the actual virus, and the spike protein are the orange spikes, and the nucleocapsid protein is the blue wrapped around the RNA. And so that's the one that's tested for with the rapid test, not the other. All right. I've had people say, I've had COVID already. Why should I be vaccinated? It's a very good question, and that's true for a lot of people. A lot of people have had COVID. I mean, my estimates are probably 90 to 100 million Americans already have had COVID. The main reason is because it decreases your chances of catching, well, there's several reasons. I would say the main one is that it would decrease your chances of catching COVID by probably 50% or more, and that's based on some observational studies that are relatively hot off the press. So that's a compelling reason. I do believe it strengthens the immunity, and therefore it likely gives you longer-term immunity, is intuitive. And we know this because the antibody levels in your body go up about 10-fold if you've had COVID and then received the vaccine and remeasure the antibody levels. It also probably broadens your immunity, meaning gives you better immunity to variants. The Delta variant is dangerous. It's terrible. it will not be the last one we see. It's already not the last one. There are others that are coming, and everyone assumes there'll be more. So one of the main values in the vaccine is that you'll probably have protection against other strains as well. And this is one of the rare cases that vaccine-induced immunity appears to actually be better than natural immunity. So my take-home message for any of you that have had COVID and are still unvaccinated, I do think you're in a better position than someone who's not had COVID, who's unvaccinated. But I would still say, please, please, please get the vaccine. Several of my children, my adult children, had COVID in December. I also encourage them to get vaccinated, which they did. And so I do think it's still a good idea. What about vaccine side effects? I've heard so many things. I have this conversation probably 10 times a day with patients, and I just want to give an opportunity to kind of go through factually and kind of share what we know and what we don't know. And when we talk about side effects, I think you have to look at it in different ways. The first is short term. We have a lot of data. This is just from a survey of almost 2 million people who were vaccinated between December and January who self-reported symptoms. And you can see what people actually had. Most people, 3/4 of people had pain at the injection site, but less than 50% of people had the other side effects: fatigue, headache, muscle pain, chills, fever, joint pain, nausea. These are the common ones. It seems to me that about half the people have some of these, and they are they're mild, they're self-limited. Tylenol is helpful, and for the most part, not really all that big a deal. A lot of people ask about long-term side effects, and I think it's important to know that this isn't really a thing when it comes to vaccines. And by long-term, meaning you get a vaccine now and then sometime down the road have serious complications because of it. Since the history, in the history of vaccines, this guy right here, Edward Jenner, brought us the first vaccine, smallpox, in the late 1700s. But since the history, in the history of vaccines, we have never seen a vaccine side effect appear later than about 2 months after initiation of the vaccine. And that makes sense if you think about it. We're not talking about a medicine that's in your system every single day. We're talking about a single dose of something that's then metabolized and out of your system within hours or a day or two. And so it doesn't have a chance to do something harmful to your body in a long-term perspective. I've been telling patients it would be analogous, if someone was in to see me because they were sick and we gave them a shot of an antibiotic or a steroid, they might wonder, hey, what if I have a reaction to this? What they're not thinking is, hey, I wonder if this is going to affect me 2 years from now and I'm going to develop a serious problem or a cancer because of it. Of course not. It was a single medicine that was given. Once the injection's given and everything that's in the shot is used and it's gone, all that's left is your immune system's response to now the proteins that are being produced. And that immune response is the exact same immune response we have to actual COVID infection. So from a long-term standpoint, it will not be a thing. It isn't a thing. It's never been a thing. Nor do I expect someone who gets COVID now and gets over it would then have some reaction a year from now or 2 years from now or 3 years from now. So I do find this to be one of the main objections. The other thing to realize is, at this point, we have 350 million people vaccinated. Doses of vaccine over 8 or 9 months. That is an enormous amount of data. We have not really, there's not many vaccines that we can say we have that much data on. Anything in the last 10 years, certainly we don't. And so it's not like we're just basing this on the trials, which incidentally happen to be some of the biggest vaccine trials ever done. So when Pfizer and Moderna did their trials, about 80,000 patients, that's much larger than most vaccines that probably many of you who are watching have taken. Fertility is a big concern that I run into with a lot of young women. And initially, we were hopeful it wouldn't be an issue. It always seems to come up as an objection to vaccines. But, there was one particular doctor who spread this rumor. It's incredible how rumors can grow legs and spread because this is thoroughly believed. At this point, I'm thankful we can say this many months into it. There seems to be no association with infertility. There's a database of about 130,000 women in the U.S. who have self-reported, who have had a vaccine before they were pregnant or even during the pregnancy so that they can be monitored. Even in the initial studies, there was about 30 women who didn't know they were pregnant or got pregnant after the vaccine, and there was only one miscarriage, and that happened to be in the placebo group, not the vaccine group. So I think this is not a thing to be concerned about. My teenage daughters, my college-age daughters have had this. They all want to be mamas. Would not have recommended that if I thought it was an issue. So fertility is not a concern. Well, what about serious side effects? That's something that's important. People hear about these. We tend to hear about these disproportionate to the reality. And I'm not saying these aren't a big deal. Any serious side effect, if with anything, is a big deal. Also realize, though, we see this with lots of things. We see this with medications all the time. We see this with injectable medications. Myocarditis, which is heart inflammation, there's been about 1,300 reported cases from the mRNA vaccines. That's out of nearly 340 million doses given. These tend to be self-limited, mostly in younger people, and don't tend to lead toward long-term health problems. Guillain-Barré syndrome, there's been 161 reported cases out of 13 million doses of Johnson & Johnson vaccine. TTS, which is a condition which causes an increased ability for the blood to clot, there's been 41 reported cases out of 13 million doses of Johnson & Johnson, and only 2 cases reported for the mRNA vaccines. Oh, I forgot to say, the VAERS is the Vaccine Adverse Event Reporting System, is something that the CDC requires doctors to do if they see a vaccine-related side effect. And incidentally, we do that even when we don't know for sure if that's the case. So if there's a question, if there could be, I did have a patient who had a blood clot after a vaccine. We don't know if it was from the vaccine. It wasn't immediately. It was a month or so later. It may not have had anything to do with it. We still reported it. So I do think these things are over-reported. And there have been 6,789 reports of death in people who have been vaccinated. Now, this is out of almost 360 million doses of vaccine. I think the important thing to know there, I mean, not only is it obviously statistically a very, very small percentage, but, very rarely is causality truly established. So again, doctors are erring on the side of caution when they do that. If someone who was vaccinated in the last month comes in and dies, it's often reported that this person died. Maybe they came in and had a heart attack. Maybe they had pneumonia and it wasn't because of that. So I don't truly believe that many people have passed away because of the vaccine, but that is how many have been reported. I think it's important, though, to keep it in perspective with what we've seen so far with the actual virus, which is, to date, 635,000 deaths in the United States. And so, the quick answer to the question is that the vaccines are very safe. We're holding them up to a level of scrutiny that we don't do for anything else. If we treated every medicine we prescribe, and I say we meaning the general public, if we treated every medicine we prescribe the same way that we're handling the vaccine with the concerns, no one would take anything. No one would ever take a Tylenol. I tell my patients all the time, if tomorrow morning 100 million Americans woke up and took a dose of Tylenol, there would be hundreds of cases of allergic reactions to something in the medicine or to the dye in the medicine. There might be some anaphylaxis. There might be a few people who died. And that's just what you see statistically when so many people do it. And I'm not surprised, especially in the social media age, that things are being reported and people hear about them. But I really do think that people are hearing about things out of proportion of what the reality is. And so this is some data. Hopefully it'll alleviate some concerns. I consider this a very safe vaccine. I've had it. My wife has had it. All of my kids have had it. My parents have had it. I wouldn't do that if I thought it was dangerous or unsafe. Incidentally, my wife didn't take it when she was pregnant because there was not much data at the time. I gave it to her immediately afterwards. At this point, there's enough data that if she was pregnant or one of my daughters was pregnant and unvaccinated, I would be comfortable recommending it. All right, when will the vaccines become FDA approved? I've been hearing this question more and more lately. I didn't think it mattered to anybody, but apparently it does. Pfizer applied for full vaccine approval on May 7th. Moderna applied on June 1st. Johnson & Johnson has not yet applied. The answer is we don't know, but most people assume that it'll be FDA approved in September. There's a different degree of scrutiny that things have to go through to get official FDA approval than to get emergency use authorization. But for those of you who it's creating distrust or casting doubt on the safety, please don't let it do that. The delay is not because of that. It's also because the FDA has its hands full in approving new things constantly for treatments and things as such. But I believe it's forthcoming. I expect within a month that there'll be official approval of Pfizer first and then probably Moderna. What about the booster? As of right now, the FDA has approved and the CDC has recommended a third dose of Pfizer or Moderna vaccine just for immunocompromised patients. So anyone on chemotherapy, anyone actively being treated for cancer, people on immunosuppressant medication. However, a true booster, meaning a third dose, will be available to anyone over 18 who's had the Pfizer or Moderna vaccine starting September 20th. I think the motivation behind this is that we've seen in people who have had the booster, and there's no recommendation yet for Johnson & Johnson. I think that will be coming. I think the reason is because as Pfizer and Moderna have done some trials, there's about a 5 to 10 fold increase in antibodies in people who have had a booster. So it probably would just improve people's immunity, particularly those over 65. So when we talked about the breakthrough hospitalizations that we're seeing and even deaths in vaccinated patients, 75% of those are in people over age 65. So people who are older naturally have less robust immune systems and are more susceptible. So I do in particular would probably encourage people over 65 to get a booster. There'll be more to come with that as we get closer, I'm sure, on specific recommendations, but for now, that's where things stand. So I hope that some of this was helpful today. My intention was just to provide some good information. The take-home message, honestly, is just that I hope that those of you who are not vaccinated would please consider getting vaccinated. It's harder and harder to watch people who are sick with this illness suffer. I have so many stories and images burned into my head and my brain, and it's been difficult to watch. Last year all of these severe illnesses and deaths were tragic, but now it feels tragic in a different kind of way because it feels preventable. Last year we didn't have a lot to offer treatment-wise, and nothing from a prevention standpoint. Now we have a little more to offer treatment-wise, but not a lot more. But we do have prevention, and prevention always beats treatment and cure. And so what we have is a gift. I truly think this vaccine is an answer to our prayers. I hate that it's become so polarizing. I hate that people view it as something other than what it is, which is a vaccine. So many people who wouldn't balk at getting a tetanus shot or a polio shot or a meningitis shot for their child for college view this as something wholly different, and it isn't. It's a good vaccine. And whether or not you trust the government is irrelevant. The government did not produce the vaccine. Trump and his administration paved the way for the people who normally make these vaccines to do their job and to do it swiftly. And they did, and they delivered something remarkable and an incredible benefit to mankind that's saving untold number of lives. And so if you're on the fence or if you're unvaccinated, I ask that you please would get vaccinated. And the other thing I would say is just to pray. Pray for our country, pray for the world. Our healthcare system is in crisis, and the average person may not see that until they become a part of it unwillingly. But it's difficult. Staff is demoralized. There's much less staff available than we had a year ago at this time, and that's the case everywhere. And people are being stretched thin, and so pray for our local healthcare community, and do your part, please, by getting vaccinated, and don't be afraid to mask up when you're in public and indoor settings, especially that are crowded. Anyway, thank you for your time, and God bless you.